The World Health Organization recently released updated COVID-19 guidelines on discharging positive patients who are not showing any symptoms of the disease. Chief Medical Officer Dr. Shamdir Prasad explained that there are conditions for these patients to be released.
What they're finding is that, asymptomatic people, once they remain so for a period of time, they can be cleared. Some areas we're having problems with getting repeated samples done. So there are new guidelines now issued by WHO, which we're being guided by.
Dr. Prasad said following discharge, the Ministry of Public Health keep in contact with the patients to find out if any symptoms of COVID-19 develop later.
At least they should complete 14 days. Okay, 10 plus 4. All right?
Okay.
The last 4 days must be totally symptom-free. They must have temperature checks in the normal range. They must also have no respiratory symptoms and no other findings. When we discharge them, we do daily follow-up the next 7 days. And then on the 7th day, we do daily follow-up by telephone. On the 7th day, we are also recommending that they have a clinical evaluation, right? In the event that they have any late onset. We also brief them so that if at any time, any occurrence, unusual occurrence, loss of taste, loss of smell, any lesions, any skin reaction occur, that they immediately make contact with the regional center, wherever they are. All right?
In its updated guidelines, the WHO stated that it appears safe to release patients from isolation based on clinical criteria that require a minimum time in isolation of 13 days rather than strictly repeated PCR results. Previously, persons had to be tested negative twice for COVID-19 within 24 hours for them to be released from isolation. There have been instances where asymptomatic persons spent 40 to 100 days in isolation as their PCR test showed positive results. It was pointed out that the strict reliance on PCR confirmation creates other risks, including straining resources and limiting access to health care for new patients with acute disease. WHO in its updated guidelines said it is important to know that patients' symptoms have been resolved for at least 3 days before release from isolation. Ghana recorded over 370 cases of the disease thus far, with over 180 recoveries and 20 deaths. Bibi Katun reporting for the newsroom.